Assalamu alaikum wa rahmatullahi wa barakatuh. Very good evening. This is Health Matters. I'm Hawa Solomon. Do stay with me for the next hour as we cover pregnancy and COVID-19. I know it's something that we've covered a couple of months back, but it's evolving. Let's see what happens now. So there's both pregnancy, your pregnancy, and the situation of birth. What's going on at the hospitals, what's going on at MOUs, with various midwives, the protocols, and also what needs to happen when the baby is born. Today we speak to specialist obstetrician gynecologist Dr. Malika van der Skeef, all the way from Cape Town. We'll be linking up with her via social distance, and we have our wellness message as well with Zuhair Girash, founder of Afia Healing. But before that, let's have a look at South African stats for COVID-19. So the new case is just over 3,700 for today and rising. South Africa is sitting at the top 5, I think, top 5, top 10, somewhere between number 5 and number 6 in the world with the highest COVID-19 positive cases. Let's pray for everyone, and let's also take this moment to, I think, appreciate the fact that, you know, you've not positive, you haven't experienced it, but it's gotten to the level where you know someone now that has it and has possibly also passed away from COVID-19. We say a big thank you, shukran, to everyone who always participates in the show. We know you are there, out there. You can always watch us via itvnetworks.tv. Click on live stream. The YouTube show will be uploaded ASAP after this, and you can also catch the repeats later on this week, which will play out tomorrow and again on Sunday. So let's now link up with Zuhair Girash, our wellness coach and founder of Afia Healing. He also has a Facebook page. Please do follow the Afia Healing chat and their various videos to support you during lockdown and any wellness, I think, you know, situation that you are in that you need to get over. And it's not just your mental well-being. They get deep down to the roots when it's also medical. So let's chat to Zuhair. Assalamu alaikum to you and welcome back, Zuhair.
Wa alaikum salam wa rahmatullah. How are you doing?
Good, alhamdulillah. The sun is shining out there in the UK. An hour behind, 7:35. Yeah. Enjoying the sun still. You've just made asr, you said.
Yes.
Okay.
Alhamdulillah, we're experiencing our 2 days of summer now. So it's been about 32 degrees, alhamdulillah. And now everyone's complaining because it's too hot. So you can't win either way. It's usually too cold or it's too hot or it's just...
Lots of ice for the day, yes. I know in South Africa and in some parts of the province, especially in the Western Cape, you have all seasons in one day. So they complain all year. You've experienced that. So let's talk about, pregnancy, COVID-19, the women's mixed emotions that already exist. And then there's COVID-19, the fears around that. And you've often spoke about grounding. So let's include some of that in there.
Bismillah ar-Rahman ar-Rahim. Alhamdulillahi Rabbil Alameen. Salatu wassalamu ala ashrafil anbiya wal mursaleen. Wa ala alihi wa sahbihi ajma'in. One of the things that's coming up a lot is regards to uncertainty, the anxiety and the fear that is so prevalent. And especially now in South Africa, I think over the last couple of months while we've been doing these sessions, and I've been following, the numbers that are being shown up on screen throughout the provinces. And it's shocking to see how the numbers are going up. But the other thing that we also have to take into account is that the numbers will rise according to the number of tests that are being done. So you might be the 5th and 6th somewhere, highest in the world, but that's all relevant to the amount of testing that's being done. So other countries that are not being tested or the tests are not thorough enough, then, they will not show up in those charts. The other thing also is this collective fear that we have in the community. Now that it's really close to home and it's knocking on our doors, we really feel that, oh my God, what if it's me next? And alhamdulillah, there's a lot of people out there on social media that are also sort of, sharing their journeys that, okay, you know what, we've got it, we've had it, we've passed through it. Another article I saw earlier today was that at least 40% of people who've had the coronavirus actually did not display any symptoms at all. So there's hope in that as well of understanding, what is it that these people have, or is there a particular, hormone or something going on in their body that actually allows them to pass through this in a more effective and, an easier way. So all of these things, alhamdulillah, day by day, there are more, there's a deeper understanding of what's going on. There's better treatment plans in place now. But I think the restrictions still are there. And now, especially, what we're talking about today about pregnancy is the fact that, there's emotional ups and downs already with pregnancy. But then to add on to that, this overwhelm of this COVID situation, the lockdown situation, the isolation, all of this adds further stress, to the mothers to be. And this is something that we really need to speak about. And alhamdulillah, for actually bringing up this topic. We need to understand, we have so much understanding regarding, like if we eat certain foods, if we do certain movements, that it's not healthy for the baby. But I think what's always neglected or not very well understood is the fact that the emotions that we pass through, and especially that we see the women passing through in pregnancy, ultimately also has an impact on the child that they're carrying. So there's a lot of infant, manifestations of certain diseases. Then people ask, why did this child get it? But a lot of the times what we find, especially when we are working with psychosomatic connections, is the fact that, children pick up emotions from their mothers. And it's so important, and especially this is the hardest time. I mean, a lot of the things are out of the control of the mothers. But the way forward would be to actually set yourself a routine in which you meditate on a daily basis, through your dhikr, through the grounding that we spoke about, walking barefoot on the earth, but also processing emotions, becoming cognizant of what is it that's passing through my head. And just, after this, I've got another workshop that I'm delivering now, in which I've asked our participants to have a thought journal. When you wake up in the morning, what are the top 3 thoughts that are going through your head? And then before you sleep, what is it that's going through your mind? Because when you can start tracing this sort of behavior and then mental pattern that's going on, that starts to help you to get control now. So the other thing that, pregnant mothers need to understand over here is they need to have a lot of discussion with midwives and look at all the possibilities. What's going to happen when I go to the hospital? What happens if I'm isolated? Who can come with me? Who can't come with me? What support will be in place? And this is extremely, extremely important, because rather than going into, the delivery room and then suddenly being told, you can't do this, you can't do that, that in itself will add to that, already stressful situation. So please, inshallah, speak to other women out there that have been through the process during the COVID season, and see what their experiences were like. And I think it's very important to share these stories also, so that there's no surprises, once you sort of check into the hospital for that delivery process.
So the big thing on the list is to eliminate all fear, is find out as much as you can. Something quickly before you run away, Zuhair,
no problem.
Be conscious. How do you constantly, you're aware that you're feeling low, fearful, and coming back to quickly realizing that, you know what, I know A, B, and C, I don't need to be fearful. How do you bring yourself to be conscious? You spoke about grounding. What about those individuals that do not have the ocean or the grass close to them? They live in a block of flats, they can't necessarily go out. Yeah.
Walking barefoot is fine. Just find yourself anything that's outside or, basic sandstone, walk on it barefoot, inshallah, and breathe very gently and deeply. Take that breath right down into your lungs, let your belly come out. This is all abdominal breathing. And that in itself will help you to start, gathering your thoughts in. The other thing of grabbing hold of your thoughts as well is simply just to, like I said, witness what is it that I'm feeling? Why am I feeling upset now? Oh, because some person said this, or I opened up my phone and I saw a particular message. This is what has bothered me. So become aware, these are my triggers. So what can you do about triggers? Either you sort of, have discussions with those people, or you just block them, or you cut them out so that you distance yourself away from all of those things that are going to spiral you downwards from there on.
Great stuff. Said Girash, please let us know how people can connect with you again, your Facebook page.
Afia Healing, inshallah. So if they search on Afia Healing on Facebook or on YouTube, on Instagram, inshallah, lots of resources available at your disposal, inshallah, of whatever it is that you need. And then you may, send us a message, inshallah, and happy to answer your questions also.
They've also got practitioners close by. So seeing
Everywhere.
that we are everywhere. So even seeing that we are in the day and age of social distancing and social media, they can connect with you via that as well. So as you heard, he's doing his webinars also via Facebook. So please connect with him.
From the comfort of your own home.
There we go. Alhamdulillah. Connect with Zuhair and his confident team Afia Healing Practitioners. Assalamu alaikum, and don't stay up too late.
Inshallah.
He's literally going to stay up all night. We quickly need to pay the bills, and when we get back, we want your interaction on pregnancy, birth, COVID-19, and something that we will be including in the show as well is your stories. So please interact with us via our social media pages, and with the children. Let us know how they are feeling still during lockdown. I know some of the public schools are closed right now, but there are schools that are open. Those that are at home, experiencing isolation, and there has also been some stories where the pregnant ladies are coming in, and of course they need to be tested when they're coming to hospital because that's protocol, and they actually don't even realize that they're COVID-19 positive. So some scary stuff. Do you need to go and have yourself tested while you're pregnant, even showing no symptoms? That's what the gynaes are saying. They're showing zero symptoms. So interact with us, your stories, your questions, comments, even it's family members that you're calling or messaging about. Please connect with us via our WhatsApp line. We'll be back just after this. Don't go anywhere. Assalamu alaikum and welcome back. COVID-19, pregnancy and birth is a hot topic for all those pregnant moms-to-be, those that are worried about their family members that are seeing new little ones come into life, and how is the spread if they are possibly COVID-19 positive. We have our specialist obstetrician and gynecologist, Dr. Malika van der Schijf, practicing out in the southern suburbs in the Western Cape, and also Sarah Ann Jones, midwife, and they'll be chatting to us about this topic. Please do interact and send your comments, questions and queries, and let us know how you feel. If you've got any experiences, do interact with us as well. Assalamu alaikum and a very good day to you, Sarah and Dr. Malika.
Wa alaikum salam wa rahmatullahi wa barakatuh.
Oh, lovely in your pink and yellow. Nice to see you brightening up our set here today. Sarah is online with us, but let's start with you, Malika. I think,
Yes.
know, as Zuhair mentioned just before this, our wellness coach, understanding that there are so many mixed emotions with the mother, already about the unknown of the birth, because no matter how many times you go through the birth plan and you set it up, things are just not stable when you worry about that actual day. So there's the fear of COVID-19 as well. So let's just talk about any misconceptions, any worrisome ideas that patients are coming to you with. And I want to start with that before I pose my questions, and what is commonly understood by your patients with regards to COVID-19 and protecting themselves.
So thank you, Hawa, and thank you to the IMA and ITV for the opportunity to engage. Most of the patients, there are lots of anxieties, and I love the way your life coach kind of discussed it and spoke about it. There are lots of anxieties, and they start with as simple as, should I even come to the gynae? Is it an environment, or for my antenatal appointments or to my midwife appointments? Is it an environment that I can consider myself safe? So that's one example. The other is when they are there, how often should they come? How is exactly what your life coach has also said, trying to get that information, which is the unknown. What is your hospital like? When do you test? Is my partner allowed? How does my birth plan change? So that entire myriad that's there. And there's also so much anxiety around work. Should they be exposing themselves? Is their work putting them more at risk? So all of these things, I think, are things that eventually get addressed over and above the pregnancy health itself.
What sort of information should pregnant women watch out for when going onto social media and various medical sites when they've asked, what do I need to know about COVID-19 and being pregnant? Because there is lots of information and the things are changing. COVID-19 is novel and still continuously changing. So please just give us some information on, or just some safe information that they should know of.
So there are lots of sites, obviously. And as you know, there's also been so much information that's come out from government. So we have the NICD, who is very good where that's concerned. Okay. The South African Society of Obs and Gynae have actually got leaflets and pamphlets that I give to my patients, which answers common questions like, am I more likely to get the virus? What will happen to my baby? Those things. And for example, our Federation, the International of Gynae and Obstetrics, so FIGO. So there are recognized societies and sites that actually speak to safety and that speak to it in layman's terms so that it's not a lot of medical jargon that's going to confuse you. So I think that is very important. I think some of that information is available at clinics, is available on screen when they're sitting in antenatal clinics or in some of our rooms. So I think that's important to make sure that you go to those sites.
Okay, so with pregnant women, are they more likely to catch the virus, to get the virus, or is it the same protection across the board, whether you're pregnant or not? Are you more at risk than others?
Yeah. So in general, pregnant women are more susceptible to infections, or they may even feel like that, than women who are not pregnant. And as you said, we've got lots to learn about this virus, but the important thing about this is that the current evidence that we have does not suggest that pregnant women are at higher risk of becoming infected than their non-pregnant counterparts, than the general population, where that's concerned. It's also additionally to that, and Sarah can also give her experience with this as well, but also additionally the literature comes out to say that those women who are affected actually end up having lesser symptoms or less severe symptoms compared to the general population.
So, Sarah,
so that's a little reassuring.
Yeah. So Sarah, if I could bring you in here. Thank you so much for joining us, Sarah Ann Jones, our midwife for today. And you guys are usually the first person that the pregnant moms see when they're walking at the hospital. You're double checking everything. You're seeing that all is well. And I want to start with where I started with Dr. Malika as well, looking at the wellness of mommy. She has so many questions. And the whole idea of, am I even safe being here at the hospital? What are your protocols with regards to assuring them and just keeping them calm during this time? And does it also affect the baby when they are not calm and not worrisome about the 110 things of COVID-19?
Yeah, thanks very much for inviting me. I think definitely anxiety plays a huge part with baby, and obviously we found a lot of pregnancies carry over term because of the anxiety. Moms are very anxious and the labors have been quite long. But I think we just reassure our patients. We've kept our visits much the same as pre-COVID, purely because obviously we still need to keep an eye on the pregnancy. So they still need to come in for their antenatal checkups, because there are lots of things that then you can miss if you kind of don't come for your antenatal checkups. And yeah, they just follow the normal precautions that everyone else follows. We have had some people test positive, but like doctor said, very mild symptoms. We haven't had, touch wood, any pregnant mommies that have been really severely sick with it. So that's been really great.
Okay, I must just add, Sarah Ann, thank you so much for your time. I believe you just walked in by the door, yes. And you were busy with the birth most of the day, and we just about caught you in time. Thank you so much for your time. I'm sure the same arises with Dr. Malika as well. Just let's latch on to the protocols on what we need to understand and respect when hospitals have advised moms that this needs to happen. And Malika also mentioned that, try and get, Dr. Malika mentioned, try and get as much information that, when you don't get there, that you were shocked. What happens when mommies are not quite understanding what needs to happen and you have to actually calm the situation? Or hasn't that happened yet?
In visits?
Whether it's visits, whether it's, having a partner that they haven't discussed or planned, or somebody just showing up, and, it's really upsetting because mommy to be is already, mixed emotions. And what happens with baby as well? Is there any sort of separations? What are the protocols around that?
So our communication with our clients is quite thorough. Obviously, we see them quite a lot towards the end of their pregnancy, so they kind of understand who's allowed in their birth room, etc., etc. So we haven't had any surprise cases, just maybe your first-time visits. We've had a couple of clients come and then they're upset because the partner can't attend the visit. But we have reassured them they can video their partner into the consultation, so the partner can hear and ask any questions, keep it interactive. Otherwise, we are able to kind of go and meet them downstairs in the parking lot if we have to. Sometimes for the partners also, just to recognize a face that they're going to then see in labor can be quite reassuring as well.
Yeah.
So just to try and do our best from that perspective.
Sure. So Malika, you spoke about, pregnant women being even more susceptible to viruses, and this being on the top of the list, not wanting to get it. What are some of the precautionary measures that moms and the family can do to protect moms to be from getting any sort of viruses?
So it is the same that applies to the general population, is trying to prevent the droplet spread. It's being cautious when you are going out. It is wearing your mask, hand sanitizing, or washing with soap and water. So it's the general ones that we talk to the public about as well, that is all over, that you hear on television, see in the books, all of those. The other things additionally, look how we always advocate that pregnant moms during their pregnancy should be taking multivitamins, should be keeping their iron levels up, their folic acids, most importantly those two, but also general multivitamins. And as you know now, we are advocating some immune boosters and increased vitamin C, some zinc, some selenium. All of those are safe in pregnancy as well as, outside of pregnancy. So that is one. The other thing is making sure that your work environment is safe. And that if there is your exposure, can it be limited? We know that the world of work function, all operations, things have changed to such an extent that there's lots of remote learning, working, teaching, all of those courses. So there are ways and means. So I often would evaluate the patient's work situation with them so we can see what their level of risk is there. The other thing that we actively look at is we actively also look at maternity leaves, should they be early, and also actively look at an element, and Sarah must say if she does this with her clients as well, is that we often ask for an element of self-isolation before birth. And not just for you, for your partner, if they are allowed. And I know there's lots of anxiety around whether your partner is allowed in the birth room or not. And, for us at the institution at Mediclinic Constantiaberg, where I work, we're lucky but that we do, if the partner tests negative along with the mom, that they are allowed in the birth room through the birth process and after. But different hospitals have different ways and means, and some unfortunately cannot accommodate their partners. So I think education around that, but also if the partner is allowed, that they self-isolate, and also I investigate what the partner's work is and what their level of risk is that they perhaps bring home into the home. So it's looking at those as factors for trying to improve.
Okay, so Sarah, if I could bring you in here and just find out, and this is a question that's been buffering, going back and forth, we've answered it. We've spoken about it, but still it comes up. How important, and should moms still attend the prenatal visits and appointment, and how important is it?
Yeah, so we, as I said before, we've kept our visits the same. They still come and see us sort of every month until 28 weeks, and then every 2 weeks until 36 weeks, and then weekly until they go into labor. Those visits are very important, especially towards the end of the pregnancy. And basically, we do also advise our clients from about 36 weeks that they go into self-isolation. And obviously, that includes the partner as well, if the partner is going to attend the birth at whatever hospital we go to. Most hospitals require that the client is tested at 38 weeks. So by self-isolating from 36 weeks, we enable that then it's very unlikely that they will then test positive at 38 weeks. And then they continue their self-isolation until they go into labor. And it's worked well with us, up until now. We haven't had a case where we've had to manage that differently.
Malika, for you, has there been any virtual consultations that people have requested from you, or have they been quite good coming in for the antenatal appointments?
So most patients, I think, have been quite good coming in. I think we must commend most patients for taking that initial first step, for getting past the whole screening protocols that happen, the taking your temperature, the taking all of the questionnaires and things. And it's a certain level of anxiety to actually get in the car and come is number one. Number two, getting past the security check. And number three, being in the rooms. And often, like Sarah has said, there's often a level of anxiety or sometimes discomfort, so to speak, about coming to the visit without your partner. Because pregnancy in and of itself can sometimes be a process where you end up having a foggy, preggy brain and you end up forgetting things. So, often not having your partner there to help corroborate the information is sometimes a bit daunting. So I think most moms do well. The other thing, though, what I want to come in here in and around your question is actually the people who don't reach Sarah and I is those who are too scared to actually take that initial first step. And Sarah has alluded to this at some point when she mentioned it, but patients should come for their regular routine checks as it is set out, not to miss. And I've had non-COVID patients who've had pregnancy complications and they've had 6 or 8 weeks in between visits, very long visits at maybe later stages of the pregnancy. And then we haven't picked up growth issues or other issues. So I think it's also important that we have to stress to patients that as scary and as daunting as all of that is, a pregnancy still needs to be reviewed. Your antenatal care still needs to be checked, irrespective of COVID. Other than COVID, I mean, we say COVID like 2,000 times a day, but other than COVID, there is diabetes in pregnancy, there's hypertension in pregnancy, there's growth issues. Even although people can't get cigarettes legally, there's growth issues that happen with toxins that you're taking in the pregnancies. There are things that have to be sorted. So I think it's vitally important that in this forum, we actually stress, do not neglect your visits.
I think that's utmost important, whether you have COVID, you fear COVID-19 at the hospitals or not, or at the clinics. It's been something that has been punted for years doing shows on pregnancy. But shukran so much, Dr. Malika. We'll take a short break. When we get back, more of your pregnancy questions and birth on COVID-19. Back in a moment. Okay, let's talk about your rights and what you need to know around COVID-19 and pregnant women. I'm Hawa Salman. Welcome back. This is Health Matters. Thank you so much for joining us. And for all those that have sent through messages of support, there are some questions we'll deal with regards to pregnancy and COVID-19 as well as births. So we have our specialist obstetrician and gynecologist, Dr. Malika van der Skeef from the Western Cape, Cape Town, practicing out in Constantia Mediclinic. And we also have Sarah and Jones, our midwife, online. Thank you so much, ladies, once again. Okay, so interestingly, Sarah has mentioned the whole isolation thing at 36 weeks. I've also heard that pregnant women, when they're coming in for labor, they have to have themselves swabbed, them and their partners Let's talk about the protocols and why this has been implemented. What are the main reasons hospitals and the medical staff are needing patients to comply, and I think ultimately to keep them safe. But if you could just explain and elaborate a little bit more, Dr. Malika.
So it's vitally important for, as being part of the COVID team, it's important for us to ensure that we're able to know every patient's status and their partner's status, to keep the healthcare workers safe, but also to keep the patient safe as well, and to know how to deal with the mom and the labor room. Because as you know, they occupy a space, and, you know, other patients will be there. There's processes around sanitization. There's processes around keeping the healthcare workers safe. And when I say healthcare worker, the healthcare team, it's not just about the midwife or the obstetrician or the other nursing staff. It's also about your catering staff. It's about your cleaning staff, all of those. And it's vital for us to look at their safety as well as the patient's safety, vice versa, which is why we all get screened as we get into the hospital. We are overly zealous about our hand sanitization and our sanitization and cleaning and of the surfaces and areas that we work in for the patient's safety and for ours. So that's important. And as I said, it allows us to monitor the patient and if anything changes, to figure out where it is. Also, remember the world is currently revolving around COVID-19, but there are other things in obstetrics and in general medicine that would mimic COVID, but is not, and we need to look out for those as well.
Okay, great. So let's touch on that. But before we do, I'd just like to get back to say that somebody's come up and said, what is isolation for a pregnant mom? Because you've mentioned it at about 36 weeks. What does it mean to go into isolation for pregnant moms?
So what we've advised is basically that they stay at home. Obviously, they do as little shopping, etc., etc. And it depends. You have to look at the household as well. So if it's not possible for the husband to go into isolation with them, then you've got to look at separate rooms, etc., because you've really got to limit the mom from getting the virus as much as possible. So, but our moms, we've managed to get the dads to work from home as well, most of them. So then they stay at home and obviously limit the contact with other people as much as they can. Obviously, as the economy sort of started to open, that became harder. But they do have to. It's a toss between working and keeping themselves safe. So whatever they can do to the best of their ability to kind of stay home and avoid public contact.
Okay, so you're saying when mom goes into isolation, dad should follow as well.
Yeah, whoever the birthing partner is going to be, it is advisable.
All right, Malika, Dr. Malika van der Schijf, let's just talk about other complications within pregnancy. Like, as you mentioned, and rightly so, yes, COVID-19 is literally taking over the world. But there are other complications for moms, whether they are young and also at a very precarious age that they need to be watched out for when, I think is it over 40 or 45 as well, being pregnant. Let's talk about, possible complications and if COVID-19 can, exacerbate that issue.
So COVID and pregnancy is, the question comes, does COVID-19 increase the risk of pregnancy complications? Is pretty much, in answer to that, it's a big yes. Women who are so I'm going to answer that in two ways. Women who are infected with COVID and who develop pneumonia and get very ill from COVID, they do appear to have an increased frequency of preterm birth. And that, we often have to make decisions around birth. Often, most importantly, while stabilizing the mom first. So that's number one. The other thing is the important thing to remember, and you've highlighted a few of them, is that there are other comorbid conditions that accompany pregnancy. in the Western Cape, for example, we've got a high prevalence of diabetes. So, there's a high prevalence of abnormal sugars or the abnormal handling of sugars or gestational diabetes in pregnancy and all of the complications that it can arise. We must also remember that there's also pregnancies that are sometimes complicated by HIV or infections, and some complications around that depending on viral loads. There are complications around hypertension in pregnancy, which is often can affect a pregnancy and the baby quite badly if it develops within the pregnancy, like preeclampsia, or just hypertension in pregnancy without all of those. So yes, there are other pregnancy complications that can arise. And then even when we talk outside of COVID, there's anxiety, there's antenatal depression, there's postnatal depression. There's also the fact that even although we have sometimes seen more early pregnancy losses recently, and that's more my anecdotal, meaning my and some of my colleagues' experiences. And you're not sure if this is because of the anxiety around everything, around the current situation, because there hasn't really been shown a link between COVID and increased miscarriages if they contracted at an earlier stage.
Okay.
So yes, complications are certainly around.
All right. I want to come to you quickly, Sarah, and talk about the birth. What are the interactions between mom and baby after baby is born? And I know the gynecologist is there and checking up on mom, but what happens to the baby and this fear of mom wondering, listen, I'm COVID-19 positive. I'm not going to get to see my baby. I cannot breastfeed her. What has been put in place by hospital and the medical staff?
So I think I'm fortunate enough that the clinic I work at, we don't really admit positive clients. So we haven't had to deal with that, but I have had clients who I've transferred to hospital. But as far as I understand, the ruling with COVID is that it's still beneficial for mom and baby to be kept together. So as long as mom wears a mask, follows all the normal sanitation processes, cleaning her hands before breastfeeding, etc., like that, she's still allowed to keep baby with her. Baby can still room in, and she can still breastfeed as normal. She just obviously has to follow normal protocols in terms of mask wearing and sanitation.
Okay. Dr. Malika, if I could bring in,
Yes, I wanted to raise an important point which hasn't come out yet, is that what is a very reassuring thing is that all of the research that's been done now, we have not detected any viruses with the baby, in the amniotic fluid, in the cord blood, or in the breast milk, even in some of our moms who were infected. So that's what we call your vertical transmission. Okay. So that is different, different to a virus such as HIV, which can also sometimes get across to the mom, from mom to baby a lot easier, or other viruses or bacteria that can get across. So that, number one, is quite important, and that feeds into Sarah's point about when we talk about postnatal care. As you've had some of your little World Health Organization clips up there as well, it still encourages breastfeeding. It still encourages, skin to skin. It does also encourage trying to protect the baby by wearing masks, hand washing, good hand hygiene, and trying, to assist where that's concerned. So I think that's important just to highlight, so that those who have had it know that there isn't that link between vertical transmission.
Okay, so what happens with moms to be and their regular antenatal appointments that they have to attend, and they are in self-isolation, Dr. Malika?
So luckily, in my practice, I've had a few patients those who've had COVID have luckily had the opportunity where we could give them that longer interval of more than 2 weeks or equal to 4, where they, from their infective, being able to spread and being infectious, so to speak, to do that. That's number one. Number two, we have had patients who have come in and had to be checked. And then what we would do is trying to arrange it. If it is essential, is you arrange it in, and sometimes for other patients as well, you arrange it in an area where you can guarantee that the room will be well deep cleaned. You do that as the last, not when other patients are around, other people are around.
Okay.
When you can do that. But the ideal thing, this is only in extreme cases when we are close to birth. In those cases where it is that we can actually do something distantly, we do. And, ask you during all of that time to keep an eye on your fetal movements, on your signs of labor, on your resting, on your improving, check up on the patients like we do with some of our non-pregnant patients more remotely or telephonically, and follow it up in that way, and only have an admission to those patients who are critically ill. So obviously the hospitals, we have our places, we have our hospital. Most of the hospitals will be divided into your, for example, COVID positive wards, your PUI wards or patient under investigation wards until we get their results, and your so-called COVID negative wards. Okay. So there are areas that we can still get that patient to in order to access healthcare.
So the medication that's currently being used now to treat COVID-19 patients, is it safe for pregnant women?
So when we talk about yes and no. So essentially most of them, because a lot of it is supportive therapy. When you are managing at home, there's simple things like you're able to take an antipyrexia, meaning you're able to take a paracetamol. You're able to take your immune boosters and your supportive therapy, your zinc, your vitamin C, your vitamin D. If we do use antibiotics, we use ones, and we need to use that for any infections that we think there is associated with it. We are able to use that as needed. Your cough syrups, and your what we call your mucolytics to try and loosen phlegm and things for a lot of the respiratory issues, some of those are safe in pregnancy as well. And if we're talking about, as you know, sometimes this can be a disease that's also associated with thickening of your blood thinners, if we need to give it, that can be given in pregnancy. Where the yes and no answer comes in is when the patient is in ICU and needs that supportive therapy. There's some of the controversial or some of the therapies that you'll hear bandied around in America and elsewhere, and sometimes here, that we cannot give in pregnancy because it is not considered safe, because we don't know the effect on the fetus. So there are ways and means that our rather much more intelligent than me intensivists are quite good at looking at and being supportive if you have a critically ill mom where that's concerned.
What happens to moms that are going into labor during self-isolation?
Come in.
What happens?
I don't know about Sarah.
Did you get that question, Malika?
Am I understanding it correctly?
Okay, so if moms are carrying to term, they on their last, but they're in self-isolation and they are busy going into labor, what are the procedures? What happens there?
Do you mean just self-isolation, but they're negative, or the mom is positive and is quarantining?
Yeah, let's talk about the worst case scenario. Positive in quarantine.
So worst case scenario, this is what most of and I'm involved in some of our one of our public sector maternity hospitals as well, and our private sector one where I'm working at, and both of them have adequate protocols for that patient to come in, how to actually, and we do protocols and drills on how to actually get through the hospital where you are, into where you're supposed to be, into the isolation room. Even if that patient lands up having to have an emergency Caesar, which theatre complex gets used, what the staff have to use, how to protect the staff where that's concerned, who deals with them. We try and as much as possible make it one-on-one with the same nursing staff who use their barrier methods to help as well. So yes, all of the hospitals have their tick boxes and their checks and balances for the pregnant patient, and more importantly, how to protect the midwife and the obstetrician when they are involved in care for that patient.
I
and
absolutely
that
agree.
involves quite extensive
Yes.
PPE.
I visited a hospital this afternoon for an appointment, and I ran off because I didn't want to be late, and my husband came back after, and he took a while to get in because the appointment wasn't for him, but he wanted to go with. So they were just doing various balances and checks, and before they allowed him in, because he wasn't on the list to come into hospital. So I must say the hospitals are doing some great jobs out there. So for worrisome moms and other patients wanting to visit the hospital, there is no need. So Sarah, if I can come back to you quickly, let's talk about the understanding. I mean, if you're able to answer this question with regards to pregnant healthcare workers and your colleagues that find themselves within the industry as essential workers and they are pregnant, what's happening with them and how are they feeling at this time?
Yeah, I think it's a difficult thing because it is our livelihood. So we kind of can't stop working just because we're pregnant. So again, it's just about following whatever practices we can to keep ourselves as protected as possible. So like we said, the hospitals are pretty good in terms of supplying PPE, etc. So they follow all of those methods. We've got a couple of clients who see clients as healthcare workers and are currently pregnant. Obviously, the anxiety is a concern because that can have effects on the pregnancy. But we just alleviate the anxiety in terms of just follow their normal procedures, sanitizing their hands, etc., to try and keep themselves as protected as possible, and to wear the proper PPE because that's going to protect them quite well.
And if worst case scenario that they have to be put off for the period of the last of their pregnancy, they would have to discuss that with their specialist and the gynecologist.
Yeah, so it's quite a grey area at the moment because there's like such little research in terms of the effects, etc. So in terms of their rights for work and all of those sorts of things, we don't actually know. So we just kind of keep them as protected as possible. And if they can take maternity leave from 36 weeks, even sometimes 34 weeks, if they in a place where they can be exposed quite a lot, like a high risk exposure, then that's beneficial.
Okay. Ladies, we need to wrap up. I want to just find out from you, Dr. Malika, if there's anything else that we have missed, any World Health Organization, CDC information that's, evolving and that's pending with regard. You have mentioned the spread of COVID-19 between mom and baby, breastfeeding. What about cesarean sections? And also any other issues you've seen at your practice that has not necessarily come up in today's show?
So the idea is that your birth plan should stay your birth plan.
Okay.
And unless it is obstetrically indicated. So I say that, and yet there are a couple of loopholes around that, but those are more for extreme cases. For most cases, ideally, your birth plan should continue as per usual. And I think, as maybe a final word, is to say that I think I really want to echo what your life coach was saying, is that knowledge is power. So get the information ahead of time, so that when you are armed with all of that information and know that can decrease the level of anxiety, because we know birth and your birth plan is the most unpredictable plan you're ever going to have, no matter how many tick boxes we try and check.
Very true.
Yeah.
Sarah, your 30 seconds wrap up outro for us from Great Expectation Wise and the world of midwifery.
Yeah, I think just keep yourselves as protected as possible, as healthy as possible, because obviously if your immune system is good, then you should carry through. And birth is unexpected and you can't really plan, but plan as much as you can and make sure that you are aware that things can change, and have a good team. Have a team that is supportive of what you want and what your beliefs in birth are.
Well done to you, ladies, and the rest of the supportive medical staff that are out there that are doing some great work and literally in the battleground of war. in a different circumstance. And may the Almighty continue giving you guys the patience and the necessary strength, and to keep you with us for quite a while to come still. And we must say we appreciate all the healthcare workers out there that are doing some great work. Hats off to you guys. Thank you once again. Enjoy your evening. You can go and rest now, Seda and Dr. Malika. Literally put your feet up for a couple of hours or two till you're back in the grindstone again. But all the best till we chat again. Please do keep us updated as well from Great Expectations and from your side as well, Dr. Malika, on anything's evolving in the world of COVID-19. Assalamu alaikum and good evening to you as well, Seda. Goodbye.
Bye.
So there you have it, our stint of COVID-19 pregnancy and birth. Next week we'll touch on women's issues once again, so please do stay with us. Every Tuesday evening from 8 to 9:30, catch us on our YouTube channel as well. But thank you for partaking. Do not go anywhere. Still some great shows followed on ITV Networks. From myself, Hawa Salman, wassalamu alaikum and goodbye for now.